is, and then what an athletic training student is as well. All right, so let's define what an athletic trainer is. You're going to hear that term used, either athletic trainer, certified athletic trainer, or ATC. Right, so what are we? We're healthcare professionals, right? We work under the guidance of physicians. Okay, the field of athletic training encompasses prevention, evaluation, rehabilitation, diagnosis, right? Acute emergency care. We're kind of the jack of all trades, right? We're the first ones on scene for an injury. We do the evaluation, and then we follow them through until return to play. What kind of separates us from physical therapists is that we follow the entire continuum of an injury, right? Physical therapists generally see the injury after it's been diagnosed, right? Which could be anywhere from a week to a month after the injury, or maybe a surgery. And then they kind of take it all the way till someone gets ready to return to play. Whereas athletic trainer, we're there from beginning to end. Another important part to remember is that we're part of a team. We never really operate by ourselves. Like I said, we work under the guidance of a physician, so we have to have a physician in order to practice, so that way they're kind of overseeing the care that we provide. But we really can't do our jobs without a solid team of healthcare professionals, right? So that's going to be ourselves and other athletic trainers that we may be working with, a medical doctor, right? We could have a family practice doctor working with a team, or an orthopedic surgeon, or multiple, right? At UCLA, we're very lucky in that we have every specialty and every physician kind of represented with us, so that if anything pops up, we have, you know, one of the area's leading experts in the area that see the injury. Other medical professionals we might work with, right, are PTs that we've already talked about. Some people do work with chiropractors, and then physician's assistants. Strength and conditioning is also a huge part of this team, right? Because we can only take someone so far, right? They really do need strength and conditioning professionals to get them to either A, the point that they were before they got hurt, or ideally stronger than they were before they got hurt. But also, right, prevention is part of our job. So having a good strength and conditioning coach to work with to prevent injuries before they happen is so important, right? The best medicine is prevention. So if we're working hand in hand with the strength coach to develop an off-season training program, the goal is to prevent as many injuries as possible, or to hopefully mitigate some of the risk, right? So let's say we know hamstring strains are going to happen, but hopefully if we do have them, they're very low grade, they're minor, right? They're kind of grade 1 injuries that bounce back very quickly. Other parts of our team are coaches, parents, and athletic training students, right? So though they may not have a medical role with us, right? They're not involved in diagnosing or treating. These are important chains in communication that we need to make sure we're communicating with the coaches on what a practice plan is for somebody, or what limitations they may have. So the coaches need to trust our judgment, and we need to trust the coaches that they're going to listen to our advice to provide care for the athlete. Parents are also important, right? Because the athlete or the student may only be with us for a couple hours a day, versus when they go home, right? That's another 6 hours a day that they need someone to either care for them, or kind of take notes on how they're feeling, or make sure they're doing the exercises they're supposed to be doing. So parents are always a big piece of this puzzle. And then athletic training students, really it's hard for athletic trainers to do their job in high school or even at university setting. Right now, we don't have any students at UCLA because of COVID, and we're really struggling on how, if we do have a season, how is this going to happen without students, right? Students really do help us, not only with the logistics of like setting up a practice and, you know, helping hydration, but also it's a big learning piece, right? Teaching students and having students then help us provide the care. All these are important parts of a medical team. Right, so some traditional job settings for an athletic trainer, right? What we kind of know off the top of our head is professional sports, right? Every professional sport, from baseball, hockey, football, soccer, golf, tennis, right? Everyone kind of has an athletic trainer on that team. Colleges and universities, depending on the size of the university, they're going to have multiple, right? So UCLA, we have one for each team, and then some teams have more than one, right? Some of them have 2 or 3 assigned to that team. Some smaller colleges, right, like a junior college or a community college, they may only have like 3 ATCs for all of the sports at that school. So everyone has an athletic trainer. It's just a matter of how many do they have to provide care for all those sports. Right, secondary schools, high schools, hopefully everyone has an athletic trainer. If not, I would pressure your school into getting one. I know that's a big push in California right now, is to get as many athletic trainers at high schools as possible, because it's the best way to help make sure we're preventing injuries, or if injuries do happen, we're treating them appropriately, right? We can't just rely on paramedics to come when it's an emergency, because that's going to be 5-10 minutes away at best. And then hospital and clinics, right? Hospital and clinics have positions for athletic trainers where they're treating injuries, right? Since our skills are in evaluation, what we can do is we can see that injury right before the doctor sees it, right? So we can kind of streamline all the information, so that way the doctor kind of knows going in what he needs to do versus wasting another 5 to 10 minutes in the history taking and kind of finding out what's going on. We can kind of expedite that process. And then some non-traditional settings, which are really kind of expanding over the past few years, right? The military started in, I think, 2014. The Marines ended up hiring a couple athletic trainers to work in the boot camp, right? So they worked in the boot camp setting to hopefully treat all the injuries that were happening during boot camp. And what they found was just a huge impact on the amount of time it took people to return back to training, or the amount of injuries they prevented. So now it's expanded so far as that every branch of the military has them, and they've even embedded athletic trainers into specific units, right? Instead of just being with, right, the boot camp or you're on base, right? There's athletic trainers embedded in units. I recently had a discussion and an interview with the Air Force, in which what they wanted me to do was provide care for 15 fighter pilots. And that was it. That was going to be my sole job, was to provide care for 15 fighter pilots. So they've really invested heavily on having athletic trainers serve not just large groups, but even small specialized forces, right? Small groups of 10 to small groups of 30. So NASA is doing the exact same thing. They have multiple athletic trainers at NASA headquarters in Florida and Texas that provide care to the entire, not only the astronauts, but the engineers and everyone working for NASA. Performing arts, right, like Cirque du Soleil and some stage shows and traveling companies hire athletic trainers, because when you think about it, right, they're athletes just as much. They're performing day in, day out, multiple times a day, so they need someone there to care for their injuries. Public safety is also a huge one that's exploding right now for police and firefighters. Firefighters, interestingly enough, when you kind of look at the research, right, they're like have 4 times the amount of risk as anyone else working to get injured, right? So that means, right, they're just trying to go to work, and they're at 4 times more of a chance of getting injured than anyone else. And typically for a firefighter, it takes them 2 times longer to return to work than someone working at a regular job, just because the demands of being a firefighter are so intense, right? They go from sitting down at the firehouse doing paperwork to all of a sudden they get a call and they're sprinting, jumping, pulling, carrying heavy weight, climbing. So this is a big area that's exploding for athletic trainers right now. And then occupational industrial, right? Some of you don't know it, but Amazon, FedEx, UPS, Coca-Cola, all these warehouses have employed athletic trainers to work directly with all of the employees, because there's so much activity, right? There's lifting, there's bending, there's so much athletic trainers that we can provide to not only prevent injuries and kind of coach people on how to do their job more efficiently from like a biomechanics perspective, but also when an injury does happen, we can start to treat it. And then that worker doesn't have to go out on workers' compensation and they're out 3 months, right? And then someone has to get paid overtime. So there's huge secondary consequences when someone gets hurt in the workplace, that athletic trainers, we can jump in and streamline that care and not only save companies a lot of money, but hopefully prevent, right, a small shoulder injury to, 5 years later, it being a surgery that person's going to have to stop doing the job they love and take up a different career. Right. So here's the $1 million question I get asked a lot is, right, okay, how do I become an ATC, right? A lot of people think that every school is going to have this program, right? It doesn't really matter where you go, but it's not true, right? So I think step one is doing what you guys are doing today, right? Getting involved early while you're in high school, trying to learn as much as possible, being involved with a camp like this, and then even trying to get involved with your athletic trainer at your high school is a huge first step, right? Because I think what we see with a lot of students is they want to do this and then they get directly involved and you start doing it and people think, oh, wait, that's not exactly what I thought it was going to be. There's a lot of hours associated with this job. It's a lot of hard work. You don't get, you know, a lot of credit. You're working behind the scenes. So I think jumping in and working with an athletic trainer to see if that's something you really want to do is the first step. And then if you do find out it's something you want to do, going to a college or university with an accredited program is what you need to start researching, right? So if you go to Katie's website right here, the Commission of Athletic Training Education, you'll be able to find a list of accredited programs, right? They can be undergraduate or graduate. I'll talk about kind of those differences in the next slide. But this formal education, this formal instruction, you're going to be schooled in all of these things right here: evidence-based practice, prevention, health promotion, examination, diagnosis, all of these things. So it's a really well-rounded education to hopefully set you up for success, right? So this is the first stepping stone, right? There's going to be a lot more things to do after this, but this is the first step you will need to take, right? So your traditional schooling, during your traditional schooling, you're going to have clinical education, right? You're going to be sent out to different places to essentially do an internship. It's called a clinical rotation, and you're going to learn hands-on how to work with high school athletes, or then you're going to move on to a college and work with college athletes, or maybe you'll go to a clinic and get hands-on experience there. So throughout the 2 years in your program, you're getting hundreds of hours, right? I think every program is a little bit different, but most programs want at least 1,200 hours of clinical experience on top of the education you're getting in the classroom, right? After all that, then it's past the BOC. That's our Board of Certification exam. So it's a national exam that you will have to pass before you get the ATC credential. And then after that, then you got to find somewhere to work. So specifically athletic training programs, right? There's a shift going on. So traditionally, right, before the accreditation came along, it was like an internship route. So you would go work for a place for a couple of years. You would have some classes, but most of your experience would be through an internship, and then you would sit for the exam, right? That changed to the undergraduate program, which is kind of what I just laid out in the previous slide. Now we're making another shift, right? All of these programs are transitioning to master's degree programs. So by fall of 2022, all of the athletic training education programs are now going to be master's programs, right? So I think fall of 2022 is the target, but that's going to be like the last class of undergraduate programs. So if you're thinking about it now, kind of have some long-term vision, right? Because if you, let's say you apply in spring of 2021, all the people after you are then going to have a master's degree in the same field that you're going to have an undergraduate degree. So kind of start thinking ahead of where the field is transitioning currently. It's transitioning to a master's. So it's going to be advantageous for you now if you're kind of getting ready for college for next year to start thinking about that master's program now, because that's where everyone's going to be. So you're going to want to be in that master's program. So some of these schools have already started this conversion process, right? Long Beach State, Fullerton, I think a couple other California schools already have their master's programs in place, and some do not, right? San Diego State, I don't think has theirs completely off the ground yet. Chapman University actually got rid of their program altogether because they didn't want to make the transition. So start looking it up, because if you looked it up a couple years ago, it's changed. So I would highly encourage you to look at the Katie website to see what schools you might be interested in. All right, so the other term we used at the beginning of this was first responder, right? And ATC is a first responder. What we generally think of a first responder is as that first person arriving to emergency scene, right? So traditionally we think of EMTs, firefighters, police officers, right? But we also want to think of ATCs as the first responders, right? Because our domain, right, is not the public sector, right? We're not providing care for everyone. We're providing care for athletes on the field, the court, or even the pool, right? So we're right there, and we're going to be the first responder for our team or the sport that we're supervising, right? So ATCs and even the students that we have, right? Athletic training students are first responders. It's always important to remember that ATCs, we have emergency plans in place for every scenario, right? Specifically, I can kind of talk about UCLA. We have over 25 emergency action plans, and that's just based off of the different venues we have, right? We have a whole nother group of emergency action plans depending on the nature of the injury, right? If there's a heat-related injury where someone's potentially going into heat exhaustion or heat stroke, we have a plan in place. If there's a neck injury, we have a plan in place. So these plans are vital for not only the ATC, but for the students, the coaches, and everyone involved to kind of know what's going to happen. So that way, if an emergency happens, we can jump right in and put this plan in place. There's no kind of deciding, right? The plan's already there and we know what to do, right? So it's important that everyone knows their role and stays calm, right? There's going to be enough panic going on with the injured athlete or the other athletes around. Sometimes parents are close by, so the parents might be freaking out. So it's important for us as the healthcare provider or the first responder to stay calm and really command the situation. Right, so as an athletic training student, right, what can you do? Right, it's your job to work closely with the ATC, right? We really want to just make sure that you're following our instructions, right? If we are under the direction of a physician, you guys are then under the direction of us, right? So you really need to kind of follow instructions and follow the protocols that the athletic trainer puts in place, so that way everything that we expect to happen does happen, right? Generally, we're not giving you these instructions just to boss you around. It's because we've had years of experience of how to manage situations and how to manage communication, lines of communication, that this stuff is so super important. So follow instructions is key. That's number one. Traditionally, at the end of this class, you guys will be a lot more comfortable treating first aid injuries. We'll do the best we can over Zoom with some of our talks later. But first aid would be something that you guys can jump in and help with, right? So that'd be taping, wrapping, bandaging, all that stuff. Activating EMS, right? So that plan we talked about, students have a direct part in that plan, whether it's making the call or providing EMS with certain information of where they need to access the athlete, or even helping spine board, right? At UCLA, if we have a neck injury, our students are helping us spine board that athlete. So your role is going to vary, but you do have a part in that emergency action plan. Other things you can do is help oversee rehab exercises and the use of modalities. You can help us organize supplies, record injuries, all this good stuff. And then we'll talk about CPR later, but assisting with CPR is also something that you guys won't get certified this weekend, but if you do get certified later on after this, doing CPR is something that you could do as a first responder. Right, so important points, kind of like I said, you're operating under our direction. So it's really important that you try not to overstep us. We generally know that athletic training students are usually the same age as the athletes you're providing care for, right? So if you start working with your high school athletic trainer, the people you're going to be caring for are all of your friends, right? You're going to have stronger bonds, you're going to know them, you're going to hang out with them more, but it's important for us to draw those different lines, right? If you're working as an athletic training student, you need to kind of have that switch of, okay, I'm still their friend, but in this setting, I need to be professional and I'm an athletic training student providing care for them, right? And then never do anything without the knowledge or permission of the ATC. That's definitely one of our biggest pet peeves, is when you, right, give someone tape that we didn't know that they had an ankle injury, or, you know, did stretching that we didn't approve, or talk to them about the headaches and blurry vision that they were having during football practice but didn't tell us, right? All of this stuff is extremely important that your ATC knows, and there's clear lines of communication. Kind of like I said, all of this I've already said, right? Do what you know, only what you've been taught, right? So don't ever jump in and do something you don't know. If you don't know, ask. We are here to help. We want you to learn. We want this to be a valuable experience. So only do what you've been taught and what you know and what you're comfortable with, right? We can teach you an ankle, you can practice an ankle 100 times, but when it comes down to it, if you're not comfortable with it, right, then we shouldn't force you, or you shouldn't be forced to do it. We should learn how to make you comfortable, and then you can kind of jump in and do it. Like I said, never try to be a hero. Ask your ATC tons of questions, right? I think that's extremely important. Never give an athlete permission to return to play, right? That is always up to us or the physician. It should never fall onto you guys. So always, if someone's asking you like, oh, you think this is okay for me to go back? Always kind of redirect them to us, right? And then just for protection of health information, right? You're going to know things that other people don't know, right? Your starting quarterback got hurt and you know he's not going to play this week, but it is not your role. It's actually against the law for you to discuss that information with outside people, right? That's breaking a health information law. Last point here is just kind of discussing ATCs during COVID, right? This is a whole unique situation the past 5 months. So what have we been doing without sports? So a couple of things we've been doing to kind of transition into some new roles and needs for athletic trainers is contact tracing, right? So athletes or patients that kind of have been diagnosed with COVID, right? We can jump in and help contact trace who was in a high risk contact situation with that person, so that they can be notified and quarantined appropriately. Entry screening has kind of been key at a lot of healthcare facilities, even universities, and as sports start back up. Entry screening, right? So taking temperatures, doing daily questionnaires and things like that. So ATCs have been very crucial to this whole process. Another unique feature of this, right, is we went into lockdown for at least 3 months, where at least at UCLA, I'll speak for UCLA specifically, right? We sent all of our athletes home for 3 months, and we had no idea what they were doing, whether they're working out or not. So now that we can kind of start doing stuff again, it was very important that we did a very thorough evaluation and a very careful return to training and play protocol. So I was kind of tasked with writing the entire protocol for return to play at UCLA. So it's very important that we follow this appropriately, because the person could have been sitting at home for 3 months. And if we kind of jump back into what they were doing when they left, right, we're just running the risk of injuries. A couple other things is policies and procedures, right? So with this whole new COVID thing, policies and procedures of how to manage positive COVID cases or prevent COVID cases has been crucial, right? So there's pages and pages and pages of documents created by ATCs and the medical team to show the university or the school or the company how we're going to navigate these things as they pop up. And then lastly, telemedicine, right? This has kind of been, I think, a new forefront for a lot of us is, okay, if we can't be in close contact with our athletes, how do we still provide care for them, right? If we had someone that suffered an ACL surgery and then went home for 3 months, right, they still need to be doing the rehab. So learning how to do Zoom rehab has been, I think, a learning curve for all of us, but it's still very important that we didn't just stop caring for them during those 3 months. So it's been a roller coaster, but I think at the end of the day, it's kind of shown everyone that ATs can do a lot more things. If there's no sports, we're still very vital to kind of overall healthcare. So that's it. That's all I got. Were there any questions in the chat box, Jasmine?